Alright guys, so for those of you who've asked which one's the sleepy guy model, it's this one. It's actually more formally called the Duramater model. So I'm going to turn it around. So hopefully you recognize you got your parietal bones here with that sagittal suture. I'm going to take that part off. Here you are looking at Duramater. So I'll get into the sinuses in just a minute. I want to first focus on this area right here. It may look daunting, but the thing to remember about the cranial nerves is they're mostly going in order if you go from anterior down to posterior. So we'll start with this one right here. This is cranial nerve number 1, the olfactory nerve. This little bulbous end here is the olfactory bulb. Number 2, right here, those are the optic nerves, cranial nerve number 2. Now 3 and 4 on this model are the hardest ones for most people to identify. So notice tucked right in here, there's 2 nerves. There's a larger one right here, and then there's a smaller one sitting on top of it. The larger one is cranial nerve 3, oculomotor. Number 4 is sitting on top of it. That's the trochlear nerve. Now on the other side, they haven't taken away this little bit of Duramater to help you see trochlear, but oculomotor is sticking out right here. So that's number 4. We then move to this pretty large one here. That is cranial nerve number 5, trigeminal. Now, if you remember we don't have this as a term for lab, but for lecture, it is helpful to notice that trigeminal has got 3 different branches here. So the most superior one is the ophthalmic division. This one here is the maxillary division. And the one on the bottom is the mandibular division. So divisions 1, 2, and 3. So moving back, again, that's cranial nerve 5, trigeminal. If we move a little more medially, we've got this one on either side. That's cranial nerve 6, abducent or abducens. Then we're going to move over to this little duo on either side. So those are going to go through the internal acoustic meatus. The first one, or the most anterior of them, is cranial nerve number 7. That's the facial nerve. And then right behind it here is cranial nerve 8, vestibulocochlear. We're then going to jump down to this trio right here. So the one that is most anterior is going to be cranial nerve 9, glossopharyngeal. The one in the middle is good old vagus, cranial nerve 10, the vagus nerve. And then this one that is coming up from the spinal cord, this is cranial nerve 11, the accessory nerve or accessory spinal nerve. And then if I move back medially, I have number 12. This is the hypoglossal nerve. Now notice nerves aren't the only things that we're seeing in here. We have the posterior portion of the cerebral arterial circle or circle of Willis. These 2 are internal carotid artery, shows up on a bunch of models. As we move more inferiorly, we get the basilar artery, and then it's going to divide right here into the 2 vertebral arteries. Now notice we've got some blue back here too. These are the venous sinuses. So we've got right here, this is called the confluence of sinuses, and moving posteriorly from that, we have the straight sinus. Moving out, we have the transverse sinus. And then if we look at that piece that I pulled off at the beginning, there's our straight sinus again. You can actually see it kind of poking out right here. And there's the superior sagittal sinus. So that's our sleepy guy or Dura Mater model.